Well, it is American Heart Month, and a new report reveals nearly half of Americans don't know the 5 signs of a heart attack. Dr. Eric Penniman from Summit Medical Group is here now with what you need to know. Thanks for being here today.
Oh, it's my pleasure. Thank you.
We've been talking a lot about heart health this month. Obviously, it's very important, but it is pretty shocking that people just don't know a lot about their heart health.
Yeah, a lot of people know that a heart attack can come on with chest pain, but they often don't know some of the other signs that go along with it.
And some of these can be signs that maybe you wouldn't really suspect.
Yeah, particularly often women will have some of the more atypical signs: nausea, jaw pain, arm pain, just shortness of breath.
Okay.
You know, you're really tired, you feel like you're going to faint. Those all could be signs of an ongoing heart attack, or at least of angina.
Okay, and what about for men? Is it similar as well?
So men tend to get the more classic chest pain, which is a pressure in the chest, like somebody is sitting in the chest, but sometimes they also will get some of the atypical things, the jaw pain, the arm pain, you know, those types of things.
Okay, who is more prone to having a heart attack? Is this like a family history thing, or really anybody?
Well, what's really interesting, it's the #1 cause of death in all adults, and women die equal percent of men. It just tends to happen in women about 5 to 10 years after men.
Okay.
But women still need to be extremely diligent to try to do what they can to avoid heart disease.
You know, earlier this month we talked about Go Red for Women, and how a lot of women, they're so busy taking care of other people, they don't really take time to think about themselves. Do you see that a lot in patients?
Oh, absolutely. As a family doc for 25 years, so many women send their family in to come in, and they will take care of everybody else and themselves last. And so it's super important that everybody looks out for their own health, and certainly we all want to help encourage each other to be healthy and to be heart healthy.
So what can patients do? What do you tell your patients?
Yeah, there's so many things to try to prevent heart disease. In regards to quitting smoking, this is quitting time in Tennessee, so this is a great time to quit smoking. Tennesseans have one of the highest rates of tobacco, but you know, lowering cholesterol, controlling diabetes, and you can even do a special test that we offer at Summit Medical Group if you are really wondering, do you have any early signs, and we can measure the amount of calcium in the arteries around your heart, called a cardiac calcium score, and something they could have done themselves at Summit Medical Group at our Dean Hill Diagnostic Center.
Right, interesting. All right, and if you think you're having any of these symptoms, obviously, what should you do?
Well, if you're having chest pain and you're worried, could this be a heart attack, dial 911. Because if you're truly having a heart attack, you need to get to the emergency room where intervention can happen quickly. We like to say time is tissue, time is saving heart muscle. So call 911 right away.
All right, really important. Thanks for the advice. We appreciate it.
Absolutely.
Good to see you.
Yes.
All right, still ahead, nearly